Hi, in this video, I'll talk to you about how breast cancer is diagnosed, what we need to know about your tumor, and how we use that information to make treatment decisions. Now, breast cancer can be diagnosed initially through several different ways. One of the ways, and probably the most common way these days, is through a mammogram or an X-ray of the breast. That's usually done as part of your routine screening. That's not always the way breast cancer is found, however. Lots of women will feel an abnormality in one of their breasts when they're showering, when they're getting dressed, sometimes when they're putting on their seatbelt. Sometimes women have their breast cancer found by their partner or by their doctor in a regular breast exam. The other thing to know is that sometimes people will present with enlarged lymph glands under their arm, and that can be the way that we make the diagnosis of breast cancer. After we find an abnormality in the breast that is concerning for breast cancer, we'll then get pictures, and pictures usually are a mammogram. In women or men who are very young, we often resort to ultrasound, which uses sound waves to find the abnormality in the breast. Occasionally, people will also have an MRI, or magnetic resonance imaging of the breast. That's done in some women to find the extent of the tumor, or if we feel a tumor that we can't see on mammogram or ultrasound. That's not needed for every woman, but some women will have an MRI. Either way, the most important thing is to confirm what we're worried about is a breast cancer itself, and that we do through a biopsy, getting a little piece of tissue. The most common way we do this is through something called a core biopsy, just like what it sounds like. You would take a needle, and it's metal, and it's quite large in that it is hollow in the middle. And we're taking a piece of that tumor and pulling that out. And we generally get several samples, usually about 5, and that's done under local anesthesia. The doctors who do this will do this with as much local anesthetic as possible to make it as pain-free as possible. That doesn't mean it's completely pain-free, so if you've been through this yourself, you know that it's not without any discomfort at all. And next, the tumor is looked at under a microscope by a pathologist. This takes a long time. Pathology is a very specialized science. Not only is the tumor embedded in paraffin, wax, it's then sectioned into very tiny sections with a machine that uses a very sharp blade to cut the tumor onto very small slices and put it on wax. And then it undergoes special staining. This takes several days, so that's why there's a long time between when you have your biopsy and when you get the very specific features of the tumor told to you. So in summary, when you're diagnosed with breast cancer, we do a physical exam, we do pictures, mammogram, ultrasound, and sometimes an MRI, and then we do a biopsy. Then we send the tumor off, that biopsy specimen, off to the pathologist where they do their thing. Takes a while, and you want it to, because there's a lot of information we learn about the tumor with the pathologist, and then we go from there. Let's talk about what the pathologist report will say, what you and your doctor will learn about this cancer. The first thing I'm going to talk about is the tumor stage, which is usually the first question my patients ask me is, what stage is this? There are 2 stages. There's the clinical stage, which is what I can tell you when I examine you in the office or in the clinic. The pathologic stage we usually don't know until after you've had surgery. That includes surgery on the lymph glands or lymph nodes under the arm. This is called the axilla in medical terminology, but it's really the armpit. Also, lymph nodes can be involved over the collarbone as well. I won't talk about that right now. So the stage depends on the number of lymph nodes and whether they're involved at all, and the size of the tumor. And the earliest stage is non-invasive breast cancer. That means that the tumor has not left the ducts. It's non-invasive, it can't spread. That's stage 0 breast cancer. Stage 1 cancer is a small tumor, and the lymph nodes are negative. It's less than 2 centimeters, so well under an inch. Stage 2 breast cancer is a tumor that is has a positive lymph node, up to 3 positive nodes, or the tumor is over 2 centimeters. Stage 3 has 4 or more positive nodes, or the tumor is as high as 5 centimeters. Stage 4 is when the cancer has spread to other parts of the body, and there'll be much more information in the future about stage 4 and really all the other stages of cancer. The next thing I'll talk about briefly and make a distinction between stage and grade is grade. Grade is what the tumor looks like under the microscope, no matter the stage. And basically, it's a description, and it's numbered between 1 and 3, about how similar the tumor looks to normal breast tissue. Grade 1, it looks a lot like normal breast tissue. Grade 3, it's much more disorganized. Grade 2 is somewhere in the middle. And your report will say whether or not this is grade 1, 2, or 3. The next thing I'm going to talk about are the estrogen and progesterone receptors. Those together are called the hormone receptors. This has nothing to do with hormone levels in your body. And this will help determine whether or not you'll be given anti-hormone therapy as part of your treatment. The next thing I'll talk about is long-term. It's the human epidermal growth factor receptor 2. So for the sake of time, we call it the HER2, and we can either test for the gene or the protein, and whether or not it's overexpressed or if the gene is called overamplified. And this, again, is something not in your body, but on the tumor. This is something else the pathologist looks for. And this is also important to know in terms of defining your treatment plan. This is not important for DCIS or stage 0 or non-invasive, all the same thing. Next, I'm going to talk about the different types of treatment for breast cancer. Once you've been diagnosed with breast cancer, we usually start with surgery first. Surgery involves removal of the tumor, and for some women, the neighborhood lymph nodes or lymph glands, which are under the arm, called the axilla. What you know as the armpit is the axilla. Not everyone needs to have their lymph nodes removed. After surgery, when we know more about the tumor, its size, and the lymph node involvement, if there is any, we make decisions about what treatment comes next. For many women, radiation therapy is part of their treatment plan. We also talk about treatment that goes through your whole system, or systemic therapy, that will treat or try to remove any cells that might have escaped the primary tumor and gotten to other parts of your body. And there are 3 different types of treatment that goes through your system, or systemic therapy. The most common is hormonal therapy. This blocks the estrogen from being produced in your body and getting to the estrogen receptor, or it actually blocks the estrogen receptor itself. We also talk about targeted therapy if your tumor has the HER2 protein that we talked about earlier. And the third kind is chemotherapy, which is much better than it used to be, but it still can be pretty hard, so take extra good care of yourself. Some women who have larger tumors that are hard to remove with surgery alone, or for some women who want to find out if they have a genetic susceptibility to breast cancer, which I'll explain soon, might want to have chemotherapy first. It doesn't mean additional chemotherapy, you're just switching up the order. So instead of having surgery then chemotherapy, you're having chemotherapy first, and it makes the surgery more successful. This isn't the case for many women, but it is for some, and I think it's good to know that might be a possibility for you. I've really liked talking with you today. If you like this, click like and subscribe, and in the comments, let me know if you want to hear something else.
Perfect.